Namaste. Bonjour. Good evening. My name is Abhina Aher. I'm the transgender activist who's been affected by HIV. I also work as an associate director with India HIV/AIDS Alliance, a civil society principal recipient with the Global Fund. Hijra is socio-ethnic identity under transgender umbrella. As you know, we have a lot of transgender identity. We don't come in black and white, but we come in beautiful colors of rainbow. Some of us are sex workers, some of us use drugs, some of us are migrants, some of us are living with HIV. Do you know that there are more than 70 million transgender persons across the globe? And 49% of transgender women is vulnerable for HIV. I am a woman. I am a woman without womb. I am a woman without vagina. And often deprived in a gender affirmation and my dignity. We are the most visible and invisible community. You can see me, but you can't recognize me. And many countries treat us as criminals. When I was 6 years of age, I identified myself as a woman. The only problem with the society is that they wanted to see me as a man. I always felt that I'm not wrong. Maybe I'm born in a wrong society. My feelings and gender expressions were not being considered by the society, and I wanted a society which could understand these kind of feelings. Throughout my childhood, I was subject to mockery, discrimination, hate crimes, and family pressure. 3 times in my life, I tried to end it. I tried to commit suicide. At the age of 15 years, I faced stigma and discrimination at school. I slowly started realizing that I was different and started identifying myself as a hijra person. I started seeing around hijras who are there nearby, but they were only begging on the streets. That was when I realized that if I want to really hide, I have to really hide my identity. If I don't hide my identity, I will not be able to pursue my educations and have a dignified life. However, even after completing my education as a software programmer, I faced stigma within my workplace and several jobs. I have to leave because they found me extremely feminine. Fortunately, I came across the community organizations working on LGBT people. I became part of a social sector. I realized, but whenever I was working on the social sector also, I realized that a lot of prevention programs are too much centric on HIV services, but they were not talking about the human rights. As I was going through a gender transition and hormone treatment, which was not available in a general hospital, I needed huge resources and decided to engage into sex work, like any other young hijras do. As a sex worker, I was taking too many clients every day, and I've been subject to acute violence on the sex sites by clients and even by police officials. I was vulnerable for HIV and was introduced to substance abuse by my clients. Access to health was a huge challenge because I did not want to register myself as a male when I go to the healthcare providers, because whenever I used to go to access my healthcare services, they used to address me as sir. I was facing a double stigma, especially when I was affected by syphilis. When I was contracted by syphilis, it was very difficult for me to also access the penicillin injections because there was nobody who can come with me and access those services. In 2010, the Global Fund introduced a groundbreaking program for sexual minorities focused around community system strengthening, and India HIV Alliance became a principal recipient. Fortunately, for the first time, for the program called as Pehchan, which means identity, I became a national program manager. This was the first time when a hijra person was identified to lead a program rather than just be a beneficiary. During the first 5 years of implementation of Global Fund, we managed to reach to more than 50,000 transgender persons, but not just about services. It also helped me to improve my technical capabilities as a program management. We also worked on policy reforms. We collected data separately for transgender people, which is still missing in various countries. We also worked on punitive laws, such as Section 377, that criminalizes homosexuality and transgender person. I also encourage my government to realize the issue specifically to the transgender people and also build the capacities of transgender CBOs to implement the program and be at the front line. Through the Global Fund investment, I have worked closely with the government to improve their understanding on transgender person like me and become part of the global HIV responses in demonstrating evidences and gaps for the transgender health. The Global Fund has improved the lives of people who use drugs, women in sex work, men who have sex with men, young people, women and girls, key and vulnerable communities. Today, a sex worker who was offering sexual activities on the field side is providing prevention services through various programs for transgender people and sexual minorities like me. I am seen as an aspirational figure in my country among young transgender women. When I sit in various technical committees, they don't see me as just a transgender person, but they see me as a technical expert on the subject. Life for me and for more than 50,000 transgender people would have been precarious if Global Fund's investment wouldn't have been there. Today, you can see me proudly standing in front of you as a transgender activist. Me and millions of transgender people across the globe are not invisible anymore. If you want Abhinas like me across the globe to come here, stand proudly, and talk to you, you must invest in Global Fund today. Because when we struggle the hardest, heroes gives more, at least 14 billion. Merci beaucoup. Thank you so much.